Hi, I'm Kaylee Fales, and today we're going to be talking about some special tests for the hip and spine. Our first test is the flexion adduction axial compression test, and a positive test would look like reproduction of any symptoms, and that would tell us that there's labral pathology, so something like a tear, something like that. So we are going to passively flex the knee into about 90 degrees, and then we'll slightly adduct the hip and then provide axial compression. And we'll perform this bilaterally. This next test is very similar. It is the flexion adduction internal rotation test, and this test will look positive with reproduction of the symptoms. And this also tells us if there is labral pathology or impingement in the hip. This test, we're going to bring the knee into flexion, adduction, and then into internal rotation. And we will assess that bilaterally. This next test is called the hip scour, and a positive test would look like pain or reproduction of symptoms. And that would tell us that there is labral pathology, something going on in there, impingement, or osteoarthritis. This test, you're going to bring the hip into flexion until you meet resistance, and then you're going to abduct, and then you're going to bring the hip through 2 full ranges of motion and assess. And you will do that bilaterally. This test is the Trendelenburg test, and a positive test would look like non-weight bearing hip drops, and this would tell us that they have a weak gluteus medius. For this test, you're going to have the patient lift their foot off the ground about 2 to 3 inches, and you'll assess the movement of their hip, and you'll have them do that bilaterally. The femoral nerve traction test would look positive, or would be positive if there's a reproduction of the symptoms, and that would tell us that there is femoral nerve pathology, something going on in there. For this test, you will slightly raise the leg, and then you are going to extend the hip back, and then further flex the knee to assess the femoral nerve. The straight leg test would be positive if there is a reproduction of symptoms, and that would tell us that there is a neural pathology. There's something going on neurally. For this test, all of this will be done passively, so we will raise the patient's leg, and the hip will be adducted and internally rotated, and the knee will be completely extended, and you will lift up until the patient experiences any reproduction of symptoms. And to add more difficulty, the foot can be dorsiflexed and internally rotated and abducted to create more tension. And you'll do the asymptomatic side first. This next test is the slump test. And this would also look positive with a reproduction of symptoms, and that would tell us that there is a neural pathology. So you're going to have the patient slump forward, and then you're going to provide overpressure across their shoulders, and then they will flex their necks, and then you'll have them extend their knee, and if pain occurs, you will release the overpressure and figure out at what point the pain comes from. The Brodzinski-Koenig test would be positive if there's a reproduction of symptoms, and that would tell us that there's a neural pathology as well. This test on their own, the patient's going to flex their neck and perform a straight leg raise, as a flexion of the hip, and then they will flex their knee and then down. This next test is the Valsalva test, and very similar to the other tests. A positive test would be a reproduction of symptoms upon testing,
and that would let us know that there is a neuropathology.
So for this test, you would have your patient take a deep breath and hold it and then bear down almost as if they're trying to move their bowels, and see if there's a reproduction of their symptoms that occurred earlier.
This test is the sacroiliac compression test, and a positive test for that would look like pain when administered, and that would let us know that there is some SI sprain or dysfunction going on.
So for this test, you're going to have the patient flex their knees as well as flex their hips, and then you are going to apply downward compressive force and look for signs of a positive test.
The SI distraction test would also be positive if there is pain when the test is administered, and that would also mean that there is some sort of SI sprain or dysfunction going on.
Test, you're going to have your patient start supine, and you're going to place your hands on either side of the hip, and you're going to press down. This next test is the sacroiliac screening or dysfunction screening test, and there are a couple different things that would make it positive. So the first would be the iliac crest height. If there's a difference between that, there's a difference in the rotation felt when the patient lifts up their leg. Also, the rotation felt if the person's just sitting, if one is feels deeper than the other. Also, the height difference between the posterior superior iliac spine and the anterior superior iliac spine, as well as if the medial malleoli line up when the patient is lying down. Those all would indicate a positive test, and that would indicate that they have SI dysfunction. So for this test, you are going to feel for the posterior superior iliac spine. So you will So you locate those, and then you'll look at the height difference between the 2 points that you found. You will also then assess if there's any rotation felt, and then you'll have the patient lean forward, and you'll assess if you felt any kind of upward rotation of the posterior superior iliac spine. And then you will have the patient sit normal again, and you'll locate the posterior superior iliac spine as well as the anterior superior iliac spine, and look for the angle of the line between the two, and see if one side is higher than the other, and you'll assess this bilaterally. You will also assess the posterior superior iliac spine as they lift up one leg at a time, and see if there's any change in the rotation. For this test, you will place your hands under the calcaneus of each foot, and then you will have the patient perform a straight leg raise, and you should feel pressure on the opposing calcaneus, and you'll assess that bilaterally. If you don't feel pressure, that is a positive sign. This next test is the Stork test, and a positive test would occur if the person has a reproduction of symptoms, and that would indicate spondylolysis. For this test, you're going to have your patient flex one of their knees to about 80 degrees, and then you're going to have them lean back, and then they'll lean back forward, place their foot on the ground, and then you can look at the other side as well. This test is the Hoover test. A positive Hoover test would result in a reproduction of the symptoms, and that would indicate malingering. Find the medial malleolus for each ankle and assess if there's a height difference, if one side's higher or lower than the other. This is the lateral rib compression test, and a positive test will look like pain or crepitus when it is performed, and that would indicate a fracture. For this test, you are going to compress on the lateral sides of the person on their ribs, and you'll want to have your fingers splayed out, and you don't want to compress directly on any suspected fracture sites. So you will find, and you can compress, and you can move up or down depending on where you suspect that the fracture occurred. This is the anterior-posterior rib compression test. This would also be positive if pain or crepitus occurs, and it would also indicate a fracture of the ribs. For this test, you are going to be compressing anterior and posteriorly, and so you'll try to keep your hands together and compress, and you will try to compress around the fracture site or the suspected fracture site, not on top of it. The brachial plexus compression test would be positive if there's a reproduction of symptoms, and that would indicate that there's a brachial plexus traction injury. So for this test, you are going to find the brachial plexus, and then you will compress and look for radiating pain. You could do it on either side. Adson's test is a test that would indicate if there is brachial plexus compression, and a positive test would look like a faint pulse or numbness that occurs when this test is administered. So for this test, you are going to locate the radial pulse, and then you are going to bring their arm up. You're going to have them turn their head towards the direction of their arm, and as you laterally rotate and extend the shoulder, you're going to have them extend their neck. You'll then have them take a deep breath and hold it, and you'll look to see if the brachial pulse diminishes or disappears.